Hi, everyone. My name is Ryan Jones from Sunnybrook Research Institute in Toronto, and today I'll be presenting our work on a fully electronically steerable modular MR-guided focused ultrasound phased array system. And this work was done in collaboration with Arrays Technologies. So relative to single element transducers, phased arrays provide full electronic control of the beam geometry and direction when used for focused ultrasound thermotherapy without the need for moving parts. They can also be employed for more complex optimal sonication strategies, such as rapid scanning of the focal beam, or more complex multifoci and antifoci patterns, as well as focal rotation. So the existing MR-guided focused ultrasound body systems consist of large element, spherically curved arrays of approximately 200 elements. These systems have limited electronic steering ranges, which mean that they require mechanical translation or rotation to treat large volumes. And this can be slow and potentially introduce MR artifacts during the treatments. So a number of years ago now, our lab developed a novel prototype flat electronically steered phased array transducer for tissue ablation. And today I'd like to provide updated results, namely with a clinical scale prototype and its use in the context of thermoablation for the treatment of uterine fibroids. So here's the system shown on the right. The transducer array is comprised of transducer modules. Each module comprises 8x8 square PZT elements that operate at approximately 0.5 megahertz when driven in its lateral vibration mode. And these elements are spaced by 1.5 millimeters, which satisfies the half wavelength inter-element spacing criteria needed for full electronic steering without introducing grating lobes within the field. The phase array itself is comprised of 96 of these modules arranged in a circular pattern with a diameter of approximately 170 millimeters, which results in just over 6,000 individual transducer elements. The system was made MR compatible. So the system shown on the right is compatible with the Siemens 3T magneton Prisma system we have at Sunnybrook. And it provides multiplanar MR thermometry. So two-dimensional planes that are orthogonal approximately every 6 seconds that are used to guide the treatments. The system also is equipped with a sparse 64-element receiver array for cavitation monitoring purposes. So the first indication that this system was used for was in the treatment of uterine fibroids. And so this was a pilot, single-arm, open-label, first-in-human feasibility trial. And the ultrasound treatments recently were completed last August. So this trial enrolled 50 patients. The first 11 patients were treated on an early generation system with just over 150 millimeter aperture, so a reduced element count, just over 4,000 elements, and this was done on the GE scanner. And the remaining patients were treated on an upgraded version on the Siemens scanner. These patients were followed with clinical questionnaires and MR imaging for up to 12 months post-treatment. So here's an example patient from the trial. This particular patient received 36 sonications and resulted in a cumulative thermal dose. So that's the region above 240 cumulative equivalent minutes at 43 degrees of approximately 70 cc's. And you can see from the multiplanar contrast enhanced T1 weighted images acquired immediately post-treatment here that the non-perfused volume resulting post-treatment conforms well in this case to the treatment location. So those are denoted by the green ellipsoids, as well as the thermal dose volume, which is denoted in yellow. So just in summary, patients in this trial received approximately, on average, 25 sonications with powers of 150 watts for about 40 seconds during MR-guided focused ultrasound sessions, just over an hour in terms of ultrasound time, and just over 2 hours within the MRI itself. These patients received thermal dose volumes of approximately 25 cc's, which corresponded to immediate non-perfused volumes of about 80 cc's. And importantly, there were no off-target effects that were observed throughout the trial, namely in the bowel or spine, and no near-field damage in the skin. So in terms of the clinical scores, here on the left, I'm plotting the average quality of life increase. And this was shown to improve throughout the year post-treatment. And on the right, I'm plotting the mean symptom severity score, which was improved at 1 month and was durable throughout the year. So in summary, we've developed a 6,144 element MR-guided focused ultrasound phased array system. The system is fully electronically steerable. It was made MRI compatible. It appears safe and effective for thermoablation in uterine fibroids. It allows for large volume ablation without the need for mechanical translation. Its high element count leads to controlled ultrasound energy delivery. and its low frequency and active cooling mechanisms allow for really low dwell times, which should improve treatment times in the future. But most excitingly, this technology is modular and scalable, so it can be used for other indications that we're currently under investigating at Sunnybrook. So I'd like to thank everyone involved with this project, our sources of funding, and our industry collaborators and Reyes, and I'd be happy to take any questions.